Now let me tell you one very important point. Remember that all anti-neoplastic metabolites, right? Remember that all these anti-neoplastic anti-metabolites, all these anti-neoplastic anti-metabolites, the adverse effects associated with this particular drugs is they will cause bone marrow suppression. Alright, they will cause the bone marrow suppression. Now, you take the alkylating agents. Right, you take the alkylating agents. Remember here, alkylating agents, they are used for chronic leukemias. Right, they are used for the treatment of the chronic leukemias. Whereas, you take the anti-metabolites. Anti-metabolites, they are commonly used for acute leukemias. Right, anti-metabolites, they are used for the treatment of the acute leukemias. Alright, so this is the very important point you should remember. Now after this, let me tell you, we have a group of drugs which are considered as the radiosensitizers. Right, remember these drugs can be asked as multiple choice question here. Now what are the examples for your radiosensitizers is, they include what is called as gemcitabine is one of the radiosensitizer. Next to the gemcitabine, then we have dactinomycin, right, dactinomycin. Next we have what is called as metronidazole and as well as 5-fluorouracil. Right, metronidazole and as well as the 5-fluorouracil. Then we have mitomycin C. Right, then we have mitomycin C, which is considered as the radiosensitizer. Next we have hydroxyurea. Then you have fludarabine. Next we have paclitaxel. Right, fludarabine, then we have paclitaxel, and lastly we have what is called as irinotecan. Right, what we have what is called as the irinotecan. So remember, these are all your radiosensitizers. That includes gemcitabine, dactinomycin, metronidazole, 5-fluorouracil, mitomycin C, hydroxyurea, fludarabine, paclitaxel and as well as irinotecan.